8:35 item is the COVID-19 update. Our Public Health Director, Kathy McKay. Good morning, Kathy.
Good morning, Mr. Chair and Commissioners. I handed out the report on our data, so you can see the cumulative cases. Total in Clay County, 8,265, and in Minnesota, over 604,000. Deaths are at 92 in Clay County. Minnesota, 7,549. And then we have the out of isolation number, which gives us active cases, and it's only 15. So our number of cases have clearly been declining, which is great. In Minnesota, it's 982. So you can see the Clay County cases per week, the graph at the bottom. And, you know, we had the peak in March, and then we've since declined. So that's a really good that we're still on the decline. And the 14-day case rate is at a low of 5.89. The active cases, we have 4 cases in that 30 to 34 age range, and otherwise it's kind of scattered throughout the ages, and you see mostly it's the younger population. Cumulative cases, the highest was in the 20 to 24 range, and then in the 30 to 34 is the next range. So the cases also are affecting the younger group. Our vaccine distribution, so Clay County's data is people with 1 vaccine dose is at 54.9%, so almost 29,000. Now, just keep in mind, and we've mentioned this before, that we do not have the data from the pharmacies in North Dakota. So we know that this is low compared to what the real number would be, but there's just no accuracy without that pharmacy data. And so those with completed vaccine is 51.4%, or over 27,000 with a completed vaccine series. And then it gives the people with at least 1 dose, kind of the age range breakout there. And then the people with the completed series, and you see the highest number is that 18 to 49 range. And statewide, we're at 64.4% with 1 vaccine dose, and at 60.2 with a completed series. So what we say is we're closer to the state range than we are with our data that's incomplete because of the pharmacies. And again, that's the same age group, 18 to 49, with the highest number of vaccine doses and completed series. The goal was to get to 70%, which is our low percentage for herd immunity, by July 1st, and looks like that's going to be a challenge to get to that percentage, which is really unfortunate. So we still have a lot of people that we are hoping will avail themselves to vaccines. We're still providing vaccine through our public health site, and that's in the Family Service Center building. It's our clinic site. And so we're doing weekly opportunities for people to get the vaccine. We're also providing vaccine to the correctional facility and the juvenile detention center, those that are homebound. We've reached out to Head Start, and let's see, who else? The schools. We've reached out to all the K-12 schools. So we're really kind of trying to do a wide sweep and provide to those that we think we can reach. On the week of June 13th, there was only 42 doses. We are taking walk-ins. We are getting some walk-ins with that are needing first doses. So that's a good thing, but we're still going to provide vaccine this week. It's going to be Wednesday, Thursday again. So there's still plenty of opportunities. We're offering the walk-ins, so people there's no barriers, and they can come in, get your vaccine. You can register right when you're there. So it's at the Family Service Center building in Suite 105. So we're really encouraging people to take advantage. We still have all the 3 types of vaccine, Moderna, Johnson & Johnson, and Pfizer. So, you know, there's an opportunity to get the vaccine. And so we're really hoping people take advantage of that. You've probably heard, of the new variant strain, and we're going to see variant strains. There's a lot of them, COVID variant strains. The newest one is the Delta strain, and as long as we are not reaching herd immunity and there's still a lot of unvaccinated people, this virus is going to mutate, and that's what viruses do. So this new strain is a mutation of the original virus, and so the scientists and epidemiologists are really watching this new strain, as they do with all of those. The predominant strain in Minnesota is the B117. That's about 90% of what they're seeing in Minnesota as the variant strain that's the highest. And then we're seeing B1427. And in Clay County, we do have somewhat over 100 cases of the B117, so the most common one. And then we have around 40 of the B1427, and then the B1526, we have around 20. So we're seeing the strain in Minnesota, and again, they don't sequence all of those, so, those are rounding numbers, they're not exact. But they've seen clusters of the variant strains in those that are not vaccinated, mostly. So in the variant strain of the Delta variant strain, they're seeing that's the highest percentage that they're seeing for hospitalizations now. The hospitalizations are still not, they're not ramping up, but the ones that is causing hospitalizations is this new Delta variant. So the real push is that if we can continue to get people vaccinated, it's not too late. We'd really like to see more people come in and get their vaccinations. And so we would eliminate pockets of unvaccinated people that could be susceptible to this. And remember, the strains sometimes cause more severe illness. So, we're really trying to lower that number of people, again, that would be hospitalized and have severe illness that are infected with that. So they're seeing pockets of people that aren't vaccinated and are gathering at community events, and that's where potentially we'll see some outbreaks. So we have lots of opportunities, not only through public health, but various other healthcare facilities and pharmacies. So we're really encouraging people to still get your vaccine. We have vaccine available, and it's a good way to protect you and others around you by getting the vaccine. We still don't have any vaccine for kids under 5. So those are still, they're working on those vaccines, but there isn't a vaccine for those individuals. Any questions? I know I went through that pretty fast. Any questions on the vaccinations or the variant strain?
Commissioner Abraham.
Yes, Kathy, on the walk-in clinics that we're conducting, those are available for kids 12 and up as well, as long as they have their parents with them.
That's correct. And 12 to 17, they need parental consent. So we would have those available, and parents can come in, or we've also offered if they can get the consent ahead of time, we accept that. Correct.
Follow up to that. So the hours of operation for at the Family Service Center is what?
So Wednesday, tomorrow, we're open from 1 to 5. And then on Thursday, we're open from 9 to 1. So we're trying to give people the opportunities to, have any time of the day. But we also get requests. So we're getting homebound people that, of course, can't make it in. And we're setting some separate ones for Head Start in the schools. So, but those are operations this week. And we change those depending on the requests we get.
And those, obviously there's no cost to them to get the shot, right?
That is correct. There is no
So
cost.
What about folks that might have employment where they're working from 8 to 5? Is there any opportunity for them to schedule something
Yes.
outside of those hours?
We have reached out in the past to employers and offered it at their site. Some have taken advantage of that, but we're still doing that. We're also going to reach out to churches, and we'll offer those vaccines at churches if they want us to come. to their church and get the vaccine at the site. So we're giving plenty of opportunities out there for people to, so just call our office. We're happy to set things up for businesses. And then the vault testing site, the vault testing site is still operational. We haven't heard when they will demobilize, but it's still operational now. We just have, their latest data is just the week of June 6th is the latest data. I should get more today for the June 13th week. So the number of tests is 230, so you see, really it's kind of been in 2 to 3 to 100 at those testing sites. There's 10 testing sites across the state. Moorhead is one of them, but we're still getting some people that are doing the testing, both in Minnesota and in North Dakota. North Dakota individuals can come here for, and the testing is free. They ask for your insurance information if you want to provide it, and then they can bill the insurance, but there's no out-of-pocket cost to the individuals.
Seems every day on social media, I see somebody asking where they can get a rapid test. We don't do rapid tests ourselves, right?
Correct. We do not do the rapid tests. Some of the healthcare facilities might. You know, it's great for certain circumstances, but it's not as accurate as the PCR test, which is done at the vault testing sites. So, and the turnaround time is pretty efficient, a couple of days for the turnaround test. So there might be some circumstances where you need a rapid test, but the healthcare facilities can provide
I
those.
think you need a rapid test, don't you?
I'm going to travel, I need a rapid test, and the drugstore is
Gave
going
you-
to give it to me.
Okay.
Through the drive-through, which is going to be good. That's going to be an experience Wednesday.
Well, good luck.
All right, any other questions for Kathy? All right, thank you, Kathy.
Okay, thank you.